That's the worst of all possible phone calls to get.
Desperate families.
I don't want to do this.
Frightened patients.
Okay, you rest easy. We're going to go talk to your family.
The only place to turn. Medicine is never easy. There are no simple answers, no guarantees.
But you've kind of had these ups and downs, and that happens with operations like this. That's not uncommon.
But at Mayo Clinic, no patient has to go it alone. With its trademark team approach, every patient gets a roadmap and a team of specialists to lead the way.
Looks like there's a spot to park right there.
All right. I'll be glad when today is over with. I'm trying to think positive, but it's kind of hard. My name is Jill Lewis. I am 40 years old. We could just go home if you want to. I was diagnosed a week ago, Tuesday, with olfactory neuroblastoma. It is a tumorous cancer that grows in the olfactory area right behind your nose.
Jill has a rare and aggressive form of cancer lurking behind her face, and the olfactory nerve, the nerve that controls the sense of smell.
It was probably about 1.5 years ago. It started with sinus infections, and then this summer, realized that I had lost my sense of smell, and then I think it was in December I noticed this lump.
When Jill's doctors ordered a series of scans, they discovered a tumor the size of a golf ball behind her face. The cancer has already spread to the lymph nodes in Jill's neck. The diagnosis turned this family's world upside down. Jill, her husband Jim, and 2 children, Carly and Peter, live in Menominee, Wisconsin. Together, they made the decision to come to Mayo Clinic.
I know that no matter what happens with all of this, that I am going to get the best care there is.
Mrs. Jill Lewis.
Hi, Kate.
Do I?
Good, Kate. How are you?
That's because all my mascara isn't off.
Hello.
Dr. Carrie Olson is one of the few surgeons in the world with the skill to remove this kind of tumor.
I say it's good to see you again, but...
Jill's doing remarkably well. It's been a whirlwind for her. In a period of just a few weeks, she's gone from thinking she just had a lump in her neck to having doctors say, this is very serious. This could take your life.
And those are tumors.
Those are tumors or cancer. It's cancer that's spread to lymph nodes.
Okay, so it's cancerous tumors, or it's just cancer, or it's...
Jill and her family are finding her diagnosis difficult to come to grips with.
Cancer's a hard word.
Type of cancer you have, but also
I think everybody, when they know you're going to Mayo, a lot of times it's like, oh, you must be, something special, or something different going on because, you have to go to Mayo for it.
I think your initial reaction is that I wanted to instantly protect her. When you love someone as much as I love her, you just want to reach out and boom, I have to protect her. That's my job.
We know the tumor is right here where I could feel that lump.
I feel like I need to go to one of those, like they go to Al-Anon meeting and say, hi, my name is so-and-so, I'm alcoholic. It's like, hi, my name is Jill, I have cancer.
John Cope is preparing to go to Mayo Clinic for an operation that could save his life, but endanger one of his children.
I don't sleep. I'm thinking about it day in and day out, constantly.
For 20 years, John has suffered from chronic liver disease. Once an active family man, John is now often too weak to do the things he used to take for granted.
A month or so ago, I tried to take a walk, and I couldn't go 100 yards, and I had to turn around and come back. There was just no way I could physically do it.
We don't go out much. Actually, we don't go out at all. And I think friends have pretty much not invited us for quite a while now because they know it's difficult for us.
Within the past year, John began showing the signs of severe liver failure.
John's had a couple episodes where he lost a tremendous amount of blood and needed transfusions. And I didn't realize how badly it was affecting him till one evening he collapsed in the bathroom, and I just heard a bang and entered the bathroom, and he was on the floor unconscious, and then I knew things were getting bad.
John Cope. Good morning. Good morning. Come this way, sir. Hello, stick here.
You've got sharp needles.
Yes, we do.
During one of John's last checkups, his doctors put him on the national donor list to receive a liver for transplant,
Relax your hand for me.
but with no guarantees.
When I was told that I was eligible for the program, I was also told that your length of years on the program has nothing to do with whether you get a liver or not. It depends on how seriously ill you are. So a person could be on the list for a long, long time.
This pressure dressing, we like you to leave on for 15 minutes.
John could die within 2 years without a new liver. His chances of getting one in time from a cadaver donor are slim.
Thank you. Thank you. Good luck tomorrow.
John's 5 daughters couldn't accept that. They found a solution, but one that might put one of them in danger.
Once we found out about my dad being put on the national recipients list, we started looking into a live liver donor.
In a live liver transplant, a healthy donor gives up part of her liver, and within weeks it regenerates, and both the donor and recipient will have a normal-sized, fully functioning liver. But there are risks to the donor.
When this came about and we knew that John could have a live liver transplant and what a great option it would be, I just didn't question whether or not I should do it. I just said, it's me, I will do it.
But testing found Linda couldn't donate a liver because she wasn't a blood match for John. 3 of their daughters were.
I just had the fear of one of my children having to do it, and I thought, I've lived a great life and it should be me. And
when Mom didn't match, John's oldest daughter, Lori, stepped in. For Lori, the choice was simple.
What I'm about to do is become a donor for a live liver transplant for my father. This was not a difficult decision at all. I always tell everybody it was a no-brainer, because it really, really was. It's my father, my dad. This didn't even need a second thought.
Lori is a serious athlete with a life and career of her own, and today she has her own way of getting ready for tomorrow's trip to Mayo.
There's a lot of lasts right now. We've hit kind of our finals in everything. You know, this is the last time you're going to go to work. This is the last time you're going to go out and have dinner with your friends. It's been tough. The length of the recovery time is probably the thing that makes me, the most nervous. The morning of the surgery, I'll be nervous, scared. Hopefully, I can be somewhat strong.
So we'll be bringing you to Methodist Hospital, putting you to sleep. We have a good team that's going to be looking after you.
Jill Lewis will have her first surgery tomorrow to attack the cancer that is spreading from behind her face to the lymph nodes in her neck.
This is actually spreading out into both sides of your neck and into your right side of your salivary gland. We'll be making an incision right here in front of the ear, extending this down into the neck and across over into this side of your neck. So often with tumors, especially unusual tumors, there's good news and there's bad news a lot of times.
I'll take the good first.
I think we'll give all that good news. First, the good news. You know, we've done some pretty sophisticated testing here on you so far with the MR scans we've gotten, the PET scan, and just some of the routine tests, and we find no evidence that there's any sign of the tumor elsewhere in the body besides the head neck area. So that's probably the best news right now.
Nothing is in the lungs.
No sign of anything in the lungs or anywhere else. So that's very good news.
Tomorrow's ordeal is only the beginning. Once the lymph nodes are removed, doctors will attack the tumor behind Jill's face, a surgery that could cause bleeding or blindness.
And is there the possibility that this tumor could come back after we finish all of the treatment? The answer to that's yes. Could this tumor take a person's life? Could a person die of this tumor? The answer to that is yes, too. We can't get everybody well with this tumor.
This whole last week has been such a blur. Don't have control over everything anymore. I guess I can't even think about whys because it will do me no good. I need to focus on what I can do about this. And that's what I need to focus on.
The Cope family is doing what they enjoy most, spending time with each other. But this gathering is different. Tomorrow, John will check in at Mayo Clinic for surgery that could save his life. He has chronic liver disease, and without a new liver, he could die within 2 years.
Are you going in the water?
No, Corbin's not going.
John's chances for getting a cadaver donor liver are slim, so his oldest daughter, Lori, has volunteered to give up to 70% of her own liver to save him.
My 2 younger sisters, they're both mothers. They both have 2 children apiece. To put that kind of a risk, it didn't seem right.
Lori simply said, this is a family thing, and we're going to do it, and I'm going to do it. I certainly have some concern about endangering her life, but she's certainly going to have some pain, some discomfort. She's going to be out of work. She's going to have some substantial scarring.
That's one thing my parents asked me, if I'd be okay with this huge scar, and I told my dad, you know, put it across my face. It doesn't matter. It means he's going to live. I mean, a scar is not a big deal.
All right, Lori, I need your fingernails again.
Before tomorrow's surgery, the family shares one last meal together.
There, talent, huh? Okay, open it up and see if it tells us a story or tells us something good.
I guess if somebody had asked me, I wouldn't have been surprised that she would do this.
It says, you are generous to an extreme and always think of others.
And that's Lori. I will always be and always have been proud of her. This is something heroic, and my hero in that sense, you bet.
A little anxiety. Yeah, it's definitely getting a lot more real right now.
I've never had any doubt that Lori couldn't do it. She's very, very strong-willed, and she would step in and do it for any of us, any of her sisters, anybody.
There's no crying in baseball.
As Lori and her father check in at Mayo, the family contemplates the uncertainty of 2 loved ones undergoing major surgery at the same time. For Lori, there's the risk of infection or internal bleeding. For John, his new liver could begin to fail, putting his life at risk.
Goodbye, sweetie. Bye.
Maybe better hold it one more time.
Love you. Might see you in the morning anyway. Yeah, we'll see you in the morning.
You bet. I can see you're going to tear up.
I know. Don't cry. I already started. Okay. I'll see you later, okay?
We'll probably see each other again. You better give me a hug too, yes. We'll probably both make it. See you in the morning or afternoon tomorrow, but 24 hours from now, right?
Right.
All right.
I love you.
Me too. It's gonna go good. Don't cry now. Make me cry.
You know, I love to be around bikes. If you walk into a bike shop, all these tires, that rubber smell, you know, you just kind of breathe in and it's got a nice smell to it.
John Floyd's whole world revolves around bikes.
You're doing super, John.
He's been on one ever since he could walk.
John, look at this guy.
Tiny little red one. I don't know what happened to it though. Probably crashed it 300 times.
At 15, John biked the route of the Tour de France. He dreamed of competing one day, but that dream was shattered by an inattentive driver. While training near his home in Atlanta, John was hit by a car. The impact tore John's bike in half and threw him over the hood of the car.
All I remember was crossing a bridge, and that was about 30 minutes before the accident happened. And the next thing I remember was about 3 days later, waking up in the hospital.
You never expect something like this. As a mother, that's the worst of all possible phone calls to get. I thought it was a joke. And then there he was. We did not dream seeing him there in the trauma room, the full extent of the injuries. We knew broken arm, broken leg, concussion, all kind of what you expect when you've been hit by a car. Not knowing for several weeks out that there was a lot more to it.
3 days after the accident, doctors realized John's entire left arm was paralyzed, the nerves ripped out. The feeling and movement of the arm is controlled by a group of 5 nerves called the brachial plexus, connecting the shoulder with the spinal cord. John's accident tore all 5 of those nerves from the spinal cord. Reconnecting them is impossible. Once nerves die, they will never function again.
When I look at my arm, I expect it to look like my right arm, which is a lot bigger and is stronger, and then of course it works.
Often doctors will amputate a useless limb, or they'll do nothing at all. But John's mom, dad, and stepdad weren't ready to accept that.
There you are. Thank you.
Nor the fact that John is unable to perform the simplest tasks. For John to regain his independence, they need a miracle. They've come to Mayo Clinic to find it.
Oh, definitely. This is definitely the biggest moment I've been through. Yeah, before it, I'd say probably something in a race, but yeah, now it's this.
Hi, John. Good to see you again.
A team of specialists will attempt the impossible. Bring feeling and movement back to John's left arm and his hand, even though the nerves controlling those functions are dead.
Because his nerve roots have been avulsed, so like they've been ripped out of the spinal cord like a radish, uprooted, if you will. Since there's no connection to the spinal cord, then what we need to do is use things to substitute. So actually other nerves that are, in quotes, alive.
Substituting live nerves for the dead ones. That's the plan. The team will peel away a set of living nerves from John's rib cage and connect them to living muscle tissue taken from his legs.
In America, there are very few centers where this type of an operation would be attempted, and only a handful of centers actually in the world where this operation is performed.
The plan is already in motion. 7 weeks earlier, the surgical team took muscle from John's right leg and attached it to the still active nerve centers in his left shoulder.
I can't shrug my shoulder. It's up, forward, backward.
While John retained this small amount of motion after the accident, it's not enough.
So right now I'm not trying to lift my arm, and right now I am. That's it.
Can we take a look at your arm?
It's a strange business, this moving of tissue from one part of the body to another.
That's all that hair from your inner leg. Yeah. You gotta start shaving that. That looks good. Nice and alive, nice and pink.
Tomorrow, John's doctors will try to restore feeling and movement to John's arm all the way down to the fingers. First, they'll move still more muscle from John's legs into his arm.
Now on the leg incision, you'll have one right down about here, one incision along in here, and then the same thing right in your inner thigh.
Microsurgeon Dr. Alex Shin will do the intricate work of shifting the leg muscles into John's arm. Hand surgeon Dr. Alan Bishop will take the lead on attaching the leg muscle tendons to the tendons in his forearm that move his fingers. And then, neurosurgeon Dr. Robert Spinner will reroute the living nerves from under John's ribs to his arm and create a new neural pathway powering muscles to move his fingers and supplying sensation in his hand.
Essentially using those nerves for a new purpose. Instead of breathing, they'll move your fingers.
And that will produce some extraordinary sensations for John.
Eventually, when the sensory nerves come and grow out, when you're touched down here, you'll have a sensation that you're being touched in your chest area.
So it doesn't ever move to the hand?
Well, eventually, it will never move like mentally feeling like it's in the hand. It will always feel like it's in this area.
Okay.
This procedure is such a long shot, so untested. No one can predict whether John will ever get to feel those sensations, much less use his arm again.
My whole thing is that I just have to stay mentally positive and focused.
Jill Lewis is back at Mayo Clinic, preparing for the next battle in the seemingly endless war against the cancer that's trying to kill her.
I am absolutely amazed at how much I matter to so many people.
A tumor is lodged behind her face, between her nose and her brain. 1 week ago, Jill's doctors attacked the cancer where it had started to spread in her lymph nodes.
Since everything went so well with this one, I just feel a lot better about going into this next one.
You can just see the spots just lighting up everywhere in the neck and in the parotid area. So there's multiple activity.
Dr. Kerry Olson is Jill's primary doctor, but he will not handle this second operation alone. Neurosurgeon Dr. Michael Link will work side by side with him.
Mrs. Jill Lewis.
That's us.
Now, Jill and her husband Jim are haunted by another fear. If the cancer the doctors removed from her lymph nodes is a high-grade, fast-moving form of the disease, it may already be spreading too quickly to be stopped.
Hi, Jill. Hi, Jim.
How you doing?
How you guys doing?
Dr. Link,
We're back.
You're back.
We're back.
A little swollen from that operation.
This is where you say, wow, you look younger, Jill. You get redeeming points then.
Every time. So how have you been doing since the surgery?
I mean, it's almost frightening how well, I think.
Really? We got some good information about the tumor type. I had one of our head and neck pathologists who looked at things, and she called me and she told me that your tumor type is not the high-grade cancer.
Oh.
So that's good news. That's good news. And I think that tells us that we know that the high-grade ones are more serious. That's the best way to say it. There's no question about that. You do not have that kind.
Oh, thank you.
You do have a type of tumor that is still an aggressive tumor because of its spreading. But if it would have been the high-grade variation, we would have been much more worried.
Oh,
so we think that is definitely some good news in that regard.
I have people across the states praying today for bland tumor.
Well, that's what Dr. Link said. Let's get a bland tumor.
That's what you told me to tell them. And they are wearing beige and not eating salt today. I am not kidding.
So we're all set to go for Thursday, and we've talked about the plan, what all that's going to involve, and sort of an incision up over the top of the head.
Doctors Olson and Link must work as a team. Dr. Link will remove a section of Jill's forehead and descend on it from above. Dr. Olson will penetrate her face just to the right of the nose and probe from the side.
We just did this operation on Friday on another patient, and she's up and walking around, and still, again, like Dr. Olson said, you're young and healthy and strong. And,
the farther the doctors have to go, cutting away the cancerous tissue, the greater the risk of causing bleeding or blindness. That's in a few days. But for now, Jill and her husband cling to the joy of today's brief victory.
The news of the low-grade tumor was, that was a big thing.
Which means you're stuck with me for a while, yeah.
First thing I'm going to have you do is just change into a gown.
The Cope family has longed for this day. Devoted father and husband John is getting another chance at life. He'll receive a living donor liver transplant from his oldest daughter, Lori. It will be a long day for everyone.
What does it say? I have to do anything? You have to sign the blue pad before you leave. Where's the blue? My emotions were running pretty high last night. This morning, now I'm just kind of feeling like I'm going through that whole Jello thing where it's, somebody else's world, and this is all pretty surreal right now.
Surgery for me it's a scary idea. I've never had any health problems my whole life.
Normally like you.
Lori is giving up more than half her liver for a transplant to replace her father's failing one.
And tell me your name, please.
Lori Cope, last name is spelled C-O-P-E.
And what are they going to do for you?
I am a donor for a live liver transplant for my father. Where you get the pretty hat now?
Now you've earned your pretty hat. Pigtails and all. There you go.
Any time doctors perform transplant surgery, there are risks to both donor and recipient. Not only the usual risks of major surgery, but the possibility that the recipient's body may reject the donor organ.
All right.
Love you.
Things like this in your back, which will
I'm so proud of you.
Thank you. Don't make me cry. I won't. Do a good job. You're back.
We just think she's wonderful, and thank God we've got her.
Parade wave.
Crazy. You might get a headache, but I don't think that would be a problem. She looks like a good kid.
She's a wonderful kid.
Then we're going to put a catheter in, and then we're going to put...
Dr. Charles Rosen will perform the transplant surgery.
I'm always very taken back by people that are willing to donate a portion of their liver to someone else. It's an enormous sacrifice. We divide the liver into the right and left sides. We usually use the right side of the liver because it's larger than the left side.
Since Mayo Clinic first started performing living liver donor transplants in the summer of 2000, Doctors have performed a total of 18 successful transplants. If everything goes well with Lori and John, this will be number 19.
The right liver is taken out.
There we go.
Then we'll store that in a sterile bag on ice to await implantation in John, the recipient.
Lori Cope's sacrifice is made. About 70% of her liver has been removed.
My spirits are good. Linda said I don't even seem nervous, and I don't think I am. Get her done.
John Cope is in another room, waiting to receive his daughter's gift of life.
As long as Lori's doing okay, then that's the biggest hurdle anyhow.
Mayo Clinic doctors must now successfully implant the portion of Lori's liver in her father. What neither family nor doctors realize is that something is happening inside John's body that could make this transplant impossible and make Lori's sacrifice in vain. 15-year-old John Floyd is about to undergo the operation of a lifetime. Once a professional cyclist hopeful, an accident left him with a paralyzed left arm.
Oh, John, y'all ready? I'm ready. All right. Do you have any questions before we get started?
Mayo's innovative team approach is the best hope to reconstruct the nerves and muscles of John's unusable left arm, using muscles from his leg and nerves from his chest. His mother, father, and stepfather have helped get him this far.
All right, well, we're just going to go check on the OR. It should be ready. We'll come get you and get you down there.
Helps here? You reach okay?
Don't want you to fall out. Love you.
Oh, I know. Okay. I know y'all get it.
Yes.
All right.
Thank you, Randy. Thank you.
Later, dudes.
Okay. All right.
Ride well.
What is the IV? Y'all are going ahead and putting me down.
Putting you to sleep?
Yeah.
You okay?
I'm pretty nervous, but it's the right place to be for this type of injury. It's no fun, but you know, you get better and you get back to being your old self again.
A kid who just wants to be a kid again. It will take a neurosurgeon, a hand surgeon, and an expert in microsurgery, all working simultaneously to make this miracle happen. One is opening the leg, one the arm, and one the chest. Every second counts. When muscle tissue is taken out of the body and reattached someplace else, the risk increases that the tissue will begin to die.
What have you been doing to pick up the lateral?
Dr. Shin will remove tendons and healthy muscle from John's leg for transplant to the arm.
Right now, I just finished finding the gracilis tendon in the knee. And so my next goal is to find the tendon in this area.
Meanwhile, Dr. Bishop opens John's chest to locate his intercostal nerves.
Sarah, do you have an Army Navy?
These are located between the ribs, where they assist with breathing. These nerves are non-essential, so they can be rerouted without affecting John's ability to breathe.
Okay, so we've got sensory. These are all sensory. And we've found the branches in the arm, so everything is identified. And now we are essentially ready for the muscle to be brought to us.
Dr. Bishop has just 90 minutes to do the incredibly intricate work of stitching together all the blood vessels binding this new muscle tissue into the arm before the muscle begins to die.
The operation is technically extremely complicated, and the most critical portion of it is the microvascular repair of the blood vessels that keeps the muscle alive. Can you bring in the microscope now? We move very quickly at that point to get the microscope into the field and repair the artery and the vein to restore the circulation. The stakes are high when you do a free muscle transfer. If the muscle does not survive, then what we've hoped to accomplish will not be successful.
As the clock moves relentlessly on, and the doctors continue their intricate work, John's family waits in his room.
Muscle flap is finished, and it is looking good.
Oh, I'm so thrilled. The care has been so phenomenal here. Now these posters are a surprise for John. Lance is his hero. Cheer up, my boy.
After 4 hours of waiting, with 2 loved ones undergoing simultaneous surgeries, the Cope family gets some good news.
They are closing on Lori and starting on John.
Okay. She'll be in recovery for a couple hours before they bring her up here, right? We're halfway there. They got Lori all closed up and she's in recovery and can't wait to see her with my own eyes.
Lori Cope has given up 70% of her liver. Dr. Charles Rosen now prepares to implant it into John. But suddenly he discovers a problem, something unexpected that formed overnight. John Cope has a blood clot in the portal vein, which supplies the liver with more than half its blood flow.
We just found that he has a pretty extensive portal vein thrombosis, which we didn't see on our ultrasound preoperatively.
The vein must be reopened and the clot removed before connecting it to the liver.
I'll take that 30.
John's life and Lori's sacrifice hang in the balance.
We knew there was a clot there. We didn't know that it was completely occluding or almost completely occluding, but we took that out. The vein's a little thin there and it's going to bleed a little bit.
Finally, the clot is gone, and Dr. Rosen can get on with the real business of implanting the new liver and making sure that blood is flowing normally in and out of the new organ.
Most of the patients that are receiving the living donor transplants are a little healthier going into the operation than the cadaver donor recipients, so they can get through what a sicker patient may not be able to.
Kind of critical to line it up correctly so it doesn't twist.
As John's surgery nears the end, Lori begins to wake up.
You look good. You're hurting, huh? I wish you weren't.
Despite her pain, Lori's first thought is for her father.
Dad's okay so far.
Yeah, he's really, really good. They said they're really pleased with the size of your liver.
I told you, think big. Thinking big worked.
Everybody's happy.
We're in pretty good shape there.
The transplant team has successfully transplanted Lori's liver section into John.
It's always nice to finish up a transplant and know that things went well and all the blood vessels are hooked up right and flowing in the right direction. Now we'll just watch and keep a close eye on them.
I was just telling him you were going to be in to see him here. Hi, John. Just opened his eyes.
Oh, just waking up. You did really well. Lori's doing great. She can hardly wait to see you.
He's having a little bit of pain in his tummy. I'm going to step up and get him some pain medicine.
Okay, great. That's understandable, isn't it?
With both of their loved ones now through their immediate ordeals, the family must deal with their next fear. Will John's body reject the liver? Will Lori's sacrifice have been in vain? A team of 3 surgeons has been at work for 8 hours, attempting to restore movement to John's paralyzed left arm. Now they've reached the most unexplored territory of this procedure, installing a muscle that should make it possible for John to use not only his arm, but also his fingers.
Okay, we'll take that suture.
At this time, we have the tendons of this muscle coming down through the arm, right through here, that we're going to be attaching to the tendons that make the fingers flex, and the ones that make the thumb flex.
And see how that'll function.
The mechanics are simple, like constructing a set of ropes and pulleys. But this is living tissue. As the surgical team finishes its work, it's impossible to predict whether these newly connected tissues will work together.
1, 2, 3.
After 10 hours, the surgery is finally over.
John, you're back in your room now.
Hey, how you doing? How you feeling? Everything went really perfect. Okay, we're all smiling. You are what you eat.
How you doing, buddy?
John's ordeal began with an accident that robbed him of his arm. Now the long wait begins. Have Mayo doctors succeeded in giving him back his arm and his dreams of becoming a professional cyclist?
Say some prayers for me, though. Okay? Promise me.
Jill Lewis is about to undergo surgery to remove a tumor lodged between her nose and her brain.
Lord, now we give her to you for these hours ahead, that you guide the doctor's hands and take all fear away from Jill.
Her family members gather round, each in their own way trying to ease Jill's anxiety.
These are for so when she wakes up in the morning or this afternoon, the first thing she'll see is a smiley face.
I truly believe that these doctors are going to get this tumor out. I truly know that this is going to be okay. I am so at peace about that. Just, I'm to that point now where it's that nervous energy and it's like, let's go. I said to get out of that room. I'm not scared. I don't think I'm scared. I think the biggest thing is you just plain try not to think. And then it's so hard because that's all you're doing is thinking.
Especially this time right before.
Yeah, right. I hate this. Just want to get on the cart and go.
Gail, call the outpatient desk. Gail.
Okay. Do I go now?
Yeah.
Okay.
Okay, see ya.
Okay. I'll be fine. I know.
Okay.
Okay. Yeah.
Thanks. See ya.
I love you.
See ya. Love you too. Bye.
Jill's life hangs in the balance, and her surgeons face the unthinkable. They must remove all of the tumor for Jill to have any chance of survival. But if they are forced to cut too deeply, Jill could live out the rest of her life blind or otherwise disabled.
We obviously want to hide the incisions behind the hairline, so once her hair grows back, nobody will be able to tell she had surgery. If we can get all the tumor out and have her wake up from surgery and be the same person she was when she went to sleep, that'd be a real good result.
Two of the world's best surgeons are working as a team. One will come at the tumor from above, through Jill's forehead. The other will attack it from the side. This tumor began in the olfactory nerve, the nerve controlling the sense of smell, and started moving relentlessly inward. It has already cost Jill her sense of smell, and the doctors worry the cancer may have reached her brain.
Can I have a 3mm kerosene, please, Julie?
Dr. Link starts by opening up the front of Jill's skull.
Could I see the drill, please?
With the front of Jill's brain exposed, Dr. Link assesses how far the tumor has spread.
So far, sort of good news in that we don't see any tumor coming through and involving the covering of the brain.
Now Dr. Link probes deeper, behind the bones of her face, toward the tumor he knows is there. Meanwhile, Dr. Olson is penetrating behind the nose itself. This demands very delicate work, removing the tumor from the facial bones, blood vessels, and around the eyes.
So we're just entering the nasal cavity right now. Pick up some teeth, please.
The cancer has done its worst damage on the septum. Just inside the nose, this divides the two nasal chambers.
Again. Good. So it's quite low on the septum. We're going to have to remove a fair amount of her septum to get adequately around this tumor. Can I have a heavy scissors, please? Straight.
Entering from two directions, Doctors Olson and Link have both reached the tumor behind Jill's nose.
Yes.
I think we're all set.
Going good?
Yeah, ready for you to kind of come on in. We'll free it up and take this out together.
Okay.
Areas, parts of the tumor right now that we're taking out.
There's the main specimen.
The tumor, the size of a golf ball, has been removed. But the most difficult work is still ahead. Their partners in the pathology lab will tell them if they test positive for cancer. Every time word comes back positive, the surgeons must cut deeper, and the risk of damage or complications grows greater.
Where those smelling nerves used to run was right here, and all this bone has been destroyed by the tumor, part of the smelling nerve that connects to the brain. And we're going to, since she didn't have any sense of smell anyway, we're going to send that to pathology and make sure the tumor isn't extending along that nerve towards the brain.
Hi, this is pathology.
Hi. Of the samples that we sent you, where are you at with those?
Those are negative.
That was negative.
Yep, those are negative.
Okay.
Thanks.
That's very good news.
Jill's brain is clear of cancer, but doctors continue to test tissue behind the nose to make sure cancerous tissue is completely removed from that area as well.
Both the left and right rostrum number 2 are focally positive for esthesio.
Okay.
Okay, we'll send you more.
Okay, great. Thank you.
Let's go get some more, guys.
The left rostrum is still positive.
Okay.
Well, if we have to take more, we'll take more.
Go ahead.
The left rostrum number 5 is negative.
Okay.
After 6 hours of painstakingly walking the line between life and death, probing and cutting, it appears now that the cancerous tissue is gone.
It's just still so surprising in terms of where this was going. The last place I would have thought we would have problems with this tumor. Have been absolutely the last place.
But one critical test remains. The tumor is gone, but when Jill opens her eyes in the recovery area, will she be able to see?
Good. All right.
How's that lady doing? Good. Everything went fine, okay? Alrighty. Good.
Can you see us okay? How many fingers you see there? Perfect. How many now? Good. Okay. Good.
All right.
Okay, you rest easy. We're going to go talk to your family.
We had to take multiple separate little layers until our pathologist finally said they don't see any more tumor. Okay. And this was in tissue that looked perfectly normal to our eye. You know, really? We were way beyond what we could actually see was cancer. Okay. So again, that tells us that anytime we see findings like that or behaviors like that, we will still be recommending radiation therapy. So that's not anything different. Yeah, right. So from the standpoint of going through the operation, tolerating it well, she did very fine.
She did?
Yeah.
Good.
This was a major victory for Jill, but her long battle against cancer is far from over. It's been 5 days since doctors removed the tumor hidden behind Jill's face.
Hey.
Oh, you're up walking already.
Yeah, the escort. How are you?
How you doing?
A little better today. Things have been really good until just had a bad day yesterday. I can handle pain, I just can't handle feeling weak. And yesterday I felt really, really weak.
On Sunday you look like you're ready to go dancing, you know. I mean, you look super, but you kind of have these ups and downs, and that happens with operations like this. That's not uncommon.
Yeah.
That's not
We're ready to go. We'll do whatever.
It's good.
Here to stay for a while. Things have gone better than what we thought they would, and that's good. You still just got this next hurdle with the radiation, and that's going to be a long haul.
See you next week. Okay. All right. You take care. Okay.
I just want to get back to being Jill again. I can't wait to not think about cancer anymore, not think about tumors anymore, think about, will I be here tomorrow? I just can't wait to not think about all that stuff, And I think, that'll come, but I just wish I was there already. Yeah. That's all.
John Cope, will be on immunosuppression medications for the rest of his life. But thanks to his daughter's courage and her liver, he has every reason to hope the rest of his life will be a good long time.
You don't even look like you ran. Oh, yeah. I feel like I ran.
Lori Cope is back to the sport she loves. Her dad's liver is working well. After enduring the anguish of watching one loved one begin to die and another one risk all to save his life, this family has come to see their greatest hopes realized.
The biggest deal, I think, there's ever been in our life besides giving birth and having grandchildren. This is right up there. Yeah.
John Floyd's pioneering nerve restoration surgery may have a happy ending too, but he won't know for a year or more if he'll ever regain use of his left arm. But he isn't putting his life on hold in the meantime.
All right, so let's get our bikes together. You need to start out just like we did doing our skills. This is another skill.
6 months after a near-fatal accident, and only 4 months after surgery, John Floyd has come to the U.S. Olympic Training Center in Colorado Springs, Colorado, to train with other elite disabled athletes.
My recovery has been pretty quick, I think. I'm pretty happy to be back on my bike only 6 months after having an accident.
Nerves grow at the rate of only 1 inch per month, so any improvement is slow going. Like his hero, Lance Armstrong, John Floyd refuses to be sidelined by a brush with death.
It's very important for me to be able to ride a bike, keep riding. Why would you want to sit on the couch? I would much rather go through a lot of pain and suffering to be riding a bike.
Jill Lewis is living an unfinished story as well. She has proven that she's a warrior.
I feel super strong. I can handle pain. I just can't handle feeling weak with the radiation, and then that's going to be a long haul. And that one scares me, I think, more than the surgeries, because it just is, I know I'm going to get weak with that, or I could get weak with that. I just want to get back to being Jill again. I could have just stayed outside, you guys.
Have you ever had any radiation treatments before? Okay. I'll kind of explain to you what we're going to be doing today, okay?
Mayo's celebrated team approach to medicine has given Jill the advantage she needs to battle her cancer. The fight isn't over. She'll need a long regimen of radiation and chemotherapy.
Are you cold or anything? Do you need a blanket?
No,
or? Okay.
It's been almost 7 weeks since the surgery. It's hard to be here. It really is. It's really hard to come back. And I think it'll be better by the end of this week. It's just today is hard because I don't want to do this. I just don't want to do this.
But she is doing it. For all the brilliant teamwork among the medical professionals at Mayo Clinic, the team player who makes the ultimate difference is the patient. For Jill, her determination has made all the difference in the world.
Right now, my whole focus is to get well and do what I have to do and what I'm told to do and beyond to do my part in beating this. I'm going to hit that 2-year mark, no doubt. I'm going to hit the 5-year mark, and I'm going to hit the 10-year mark. I have too many plans. We have too many things to do, and I feel so good.